Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. It's good to be back with you all. We have a wonderful setup and agenda for you today. We've got a few people from the Flint Odyssey House. We've got Dr. Kent Key, who's going to talk to us a little bit about social determinants of health. We've got Nicole Matthews back with us to talk about how we keep kids safe. And Nurse T and Dr. Gordon are always with us to give us a little bit of what's going on in the community. They're always on the pulse of what's going on. So we'll get right into things. We have Dr. Kent Key, who's going to talk to us about social determinants of health. And I got to say, Dr. Key is one of my great colleagues. It's always great to be able to talk with him and learn from him. So thank you so much for being here with us today.
Thank you. Thank you so much for inviting me. I will transition to my slides if that's okay.
Absolutely.
Okay. All right. So good afternoon, everyone. It is afternoon, right? Good afternoon, everyone. It's a pleasure to be here, a part of this wonderful mechanism for communicating health information to our community. I'm Dr. Kent Key. I'm an assistant professor in the Division of Public Health. Well, in our new Charles Stewart Mott Department of Public Health here in the College of Human Medicine at Michigan State University. And I'm a health disparities researcher, community engaged research methodologist, but I'm a Flintstone, born and raised right here in this community. A little bit about me, I've had the opportunity of working in all sectors. I've worked for the county at GCARD on county level, looking at social determinants. I've worked at the universities. Of course, I was at University of Michigan at MiCHWA for 9 years before coming to MSU. And then I also had the opportunity of working at Flint Odyssey House Health Awareness Center. That's where I first cut my teeth on public health. So I've had a unique experience of working in the field of public health, but from those three different lenses. So I kind of bring that multi-lens experience in the work that I do, not just working for government or just working in academia or just working in community, but really bringing the totality of a real 360 kind of view around public health. And more recently, I was elected chair of the Genesee County Diversity, Equity, and Inclusion Commission on the county level for the county government. And so I'm excited to be here. These are just some of the things about me. I'm definitely not going to go through all of those. They get boring to me. I see them so much. But I really want to just kind of discuss what our goals are today. I want to talk to you about the social determinants of health. And I want to have a discussion to kind of put it in the context of public health. I'm never really shocked that a lot of people may not have necessarily heard about social determinants of health. A lot of people are really still getting a grasp on what public health is, right? Then we want to discuss the role that the social determinants of health plays in systemic and structural inequities, and then discuss ways to advance broader understanding of social determinants of health in programming. So I always, in my discussions and in my talks, kind of root a foundational definition for what health is. So we pull this from the World Health Organization, that health is a state of complete physical, mental, and social well-being, not merely the absence of illness or infirmity. So I always try to tell people that you can be disease-free and infirmity-free and still be unhealthy. So it's more than just the absence of illness and or disease. And I pull this from the World Health Organization. So it is interesting because I want to go to this slide first. It always goes out of order. So in the United States, we spend the most for healthcare costs compared to any country, every other country in the world. This is some of the data looking at how much we spend per capita on healthcare costs per household. And so when you think about our expenditures on healthcare, right, compared to other countries, yet we don't even make the top 20 countries for the highest life expectancy in the world. And so there are some issues with this. We don't make this list of countries with the highest life expectancy, yet we spend the most in healthcare. And we could also have slides to show in particular health indicators, whether we're looking at diabetes or obesity or heart disease. We'll see that our country ranks as some of the highest compared to other countries, yet we spend the most on healthcare. So definitely something is wrong. Why do we spend the most on healthcare, yet we don't even rank in the top countries regarding health and life expectancy? Part of that is because of the social determinants of health. So the social determinants of health are defined by the Centers for Disease Control and Prevention as conditions and places where people live, learn, work, and play, and affect a wide range of health risks and outcomes. These are called the social determinants of health. And these are the traditional 5 buckets that they're kind of categorized under: neighborhood and built environment, health and healthcare, social and community context, education, and economic stability. And as we progress through this presentation, we'll see the expansion of those buckets more in a comprehensive view. So I've worked with several groups. I've worked with political groups and decision makers because we realize we're constantly rotating new elected officials in, and oftentimes we don't know or understand that many of these officials don't understand the impact that the social determinants of health plays on our overall health and health care. Oftentimes people just think access to insurance, right? But it's so much more than just access to insurance and going to the doctor. And so we broke it down for some of our from youth groups that we work with. And I learned that this kind of breaking down each of the words and bringing it all together really helps people connect with what social determinants of health really means. So social means your interactions with the external environment, your friends, family, places, and different systems. Determinants are indicators, something that is affected or influenced by. And then health. Again, we just talked about health being more than just the absence of illness and disease, but it's in the context of physical, social, spiritual, mental, and well-being. So putting this all together, social determinants of health is your interactions with the external environment that affect or influence your social, spiritual, physical, and mental well-being. Here is a more broader context of the social determinants of health. So as you can see here, under those buckets or those domains, it's more comprehensive. So under economic stability, we see employment, we see income, expenses, and debt. Under neighborhood and physical environment, that's housing, that's transportation, that's safety, parks, etc. Under education, that also includes literacy and higher education and vocal training. Food, of course, access to healthy food. And then under our community context, we also see social integration and support systems, right? And discrimination. And then we also see under the healthcare system, health coverage, provider availability, cultural competence, quality of care, and provider bias. These are all things that determine or impact how healthy individuals and communities are. And we know that those also lead to different types of health outcomes, whether it's mortalities, morbidities, impacting life expectancy, our health status, etc. Here is another breakdown of the social determinants, but this one also includes biologic and genetics, right? The things that we inherited health, right? It also looks at gender as well as childhood experiences that we know ACEs and so many other experiences impact how children grow and develop. And so these just kind of shows you over time how social determinants of health have expanded to be a more comprehensive look at health and healthcare. So when I talked about genetics, right, we know genetics and genes, genomics, inherited health. There are some things that we may inherit that impacts our health. But next to your genetic code, what is the next predictor of your overall life expectancy and health? So when we think about that, the answer is your zip code. This is one of the sites that we use with Robert Woods Johnson Foundation, where you can actually go in and put your zip code in, and it will compare it to your state, to your county, and also to the United States. So I took the liberty on some other projects that I was doing and put some zip codes in the Flint area. And you can see significant difference just from the 48505 to 48503, almost 4 years of difference. But then if you compare that to Grand Blanc, which is just a couple of miles from Flint, you go from a 64 or a 67 life expectancy to 82 years, right? And then we again see on average in the county, life expectancy in Genesee County is around 75 years. And then the state of Michigan, 77, which is not that much difference from what we see overall in the United States. However, on that earlier chart that I showed you all earlier, it ranks us at like the 32nd highest life expectancy rate, meaning there are 32 other countries or 31 other countries that are ranking higher than us, yet we're spending significantly more money than those countries that are ranking higher than us on healthcare. So again, something is wrong, and we know that the determinants play a part in this. Why are the social determinants of health important? Because our overall health is impacted by many factors. Again, it starts where we live, learn, work, and play. The environment we live in, access to education, healthy food, financial stability, and good relationships or connections in our home all impact our health, right? So it's not just going to the doctor. Yes, go to the doctor. Yes, do your annual checkups and your routine screenings, but it's more than just going to the doctor and to the doctor's office that impacts the health. In actuality, if we address the social determinants of health, we're helping our medical doctors actually do their job even better. And not only that, give them a better understanding in the context of the environments by which we are living in when we're coming to their practices. So here are some models that will help us kind of look at social determinants in different conceptual frameworks. So this particular framework looks at the social, economic, and political context and governance and policies and the way they interact with our social position. And our social position also includes education, occupation, income, and gender. And then how that then impacts behavior factors, psychosocial factors, social cohesion, and biological factors, which we know then impact our overall health and well-being. And the social determinants of health is kind of like an overarching umbrella by which we see all of these interactions taking place. Another concept that we see often used is the one by the county health rankings from the Robert Woods Johnson Foundation. And in this particular model, we see very clearly that 20% of what impacts our health is clinical care. In this model, it posits that 83% comes from health behaviors, which a lot of that is influenced by environment. So like tobacco use, diet and exercise, alcohol and drug use, sexual activity. That's also influenced sometimes even by culture when we think about diet, right? And then social and economic factors such as education, employment, income, family and social support, and community safety greatly impacts our overall health outcomes. And then of course, physical environment. And we know here in Flint with the water situation, we're still bouncing back from the water crisis while we're still in it. And so air and water quality, housing and transit. And so all of these things impact our health, but it will take effective policies and programs to address those health factors so that we can then get to positive health outcomes, which will hopefully be good outcomes in regards to length of life and quality of life. This particular model kind of uses the upstream, midstream, and downstream perspective. It kind of lays out strategies, community impact, and tactics that we must use. But the point of this model is that, unfortunately, in the United States, and particularly when we think about urban populations and populations that don't go to doctor visits as much as we need to, and those that are impacted by, access to insurance, so those could be urban, rural, low socioeconomic, and then sometimes there are even communities and individuals who have adequate funding and insurance, but because of historical mistrust, may not want to go to doctors like they need to. So we need to then look at looking upstream. What are some of the tactics and strategies we need to do? Because unfortunately, in the United States, we have a trend of doing things downstream, and that's after the diabetes happens or after the stroke happens. Those are when it's most costly and we are already having to do medical interventions, where as a collective and as a country, if we could really target upstream tactics and strategies, that would be the most impactful for reducing disparities and inequities. And again, this is a model that you can use to kind of look at where energies, where resources are being targeted and impacted, and how we might want to shift more upstream so that if we continue in this downstream, we will continue to be the country that is paying the most for healthcare and still not making the list for overall health, wellness, and life expectancy compared to countries that pay significantly less amount in healthcare. This particular model, one of my colleagues sent this to me, and I love this model because it really shows, again, that upstream and downstream kind of spectrum, but it kind of shows how social inequities, how they interplay with institutional inequities, right? So a person's class, race, ethnicity, gender, sexual orientation, how it then interacts with institutional inequities within corporations and governments and agencies and schools, right? And then how that then impacts living conditions, right? So our physical environment, our social environment, right? Economic and work environment and service environment. And then how that directly impacts risk behaviors, right? Whether individuals are smoking or poor nutrition and poor physical activity, violence, et cetera. And then that impact on disease and injury and mortality. And that is going to take policy and community organizing and civic engagement if we're really going to come up with some strategic partnerships for advocacy to impact the role that institutional inequities play as they interact with individuals and produce the types of living conditions that we see here in this diagram. So in other words, the picture around social determinants is that it's more than just going to your doctor, it's more than just medical care. It's all of those other factors that influence our overall health and well-being. This particular model, again, just kind of reinforces that there are some root causes, right, that goes beyond just going to the doctor's office that impact our overall well-being. So I give an example of, let's look at housing, right? Let's look at redlining. We know that redlining was a systemic practice that was used to discriminate against people of color from getting financial loans and financial support to purchase homes, right? And historically, red lines were drawn on maps of different communities and different cities, and those areas would not be, there would be divestment for lending practices in those areas. And in those areas were predominantly people of color and poor people. And unfortunately, that helped to populate zip codes. Well, we just talked about in the previous slides, the next predictor of life expectancy outside of genetic code, your genetic health code, is your zip code. And so when we think about how systemically things like racism and sexism and classism are embedded in practices, in systems like employment and housing, right? And education and built environment. And then how those things kind of lay as the trunk of this tree, but then they produce those branches, right? That produce those health outcomes that we see. So we see the underlying system, the dominant culture, then we see the root causes, and then we see how those social determinants are impacted by that as the trunk of the tree. And then we see the branches that are the behaviors that manifest from many of those determinants and those communities and those environments. And then we see the health outcomes. And unfortunately, we see this happening generation after generation as we think about generational poverty, right? Generational trauma, those types of things. And we keep seeing very similar trends in health outcomes. Finally, there is a slide here that shows the role that effective community engagement must play if we're going to really address social determinants of health using a health equity transformation lens, right? So when we think about effective community engagement, we're thinking about building trust with communities that we're trying to impact. What that bi-directional learning, it should not be one directional, but it should be bi-directional, where community is informing research and medicine, and then medicine is also informing community. We think about equity and co-creating solutions and shared governance, and how that will build and strengthen partnerships and alliances that should be diverse, inclusive, right? And have the type of mutual value and shared power structures that will help to bring about the types of interventions and programs that's needed to expand our knowledge and then improve the overall health and healthcare programs and the policies that impact communities regarding health that should lead us to thriving communities. So these are some of the models that I use oftentimes in a lot of the talks that I give. And of course, understanding that we're centering equity in all of this. And many people have seen this type of picture when we talk about equity, but then there's this whole thing around justice, right? At some point, we want to get beyond equality. We even want to get beyond equity, where we just even tear down the barriers, right? There's another slide that I have where the fence is even removed. We shouldn't even have to have barriers, right? To people being able to do what they need to do in order to live their best life. And then again, one of the things we want to do is provide and to apply an equity frame or equity lens when we're looking at social determinants of health frameworks and addressing those systems. And it's important to do that because as we think about things like currently with ARPA dollars and other things that are happening around the country, we need the types of funding, right, to get to the types of programming and interventions that we need to actually address social determinants in a big way if we want to really impact the overall health and wellness of our communities. And so with that, I don't know where I am with time. I'm going to end and allow for questions. So that was kind of like a speed dating version of an introduction to the social determinants of health. You're muted, Jennifer.
I thought I clicked the button. Thank you. It was phenomenal. Thank you so much. I thought that was a really amazing overview and gave a lot of context for people. There's a comment in the chat that says, there's a show called Adam Ruins Everything that has an episode on redlining, and they recommend that episode. I don't know if other people have seen it. It does a great job teaching. There's a resource I use for my students, and there's a map. If I can find it while others are talking, I'll put it in. But there's a map, and you can see historically redlined neighborhoods in Flint, even, right? Yep. And you can look at different health characteristics of those neighborhoods, and you can look at how, back when homeowners loan associations were denying Black and brown people in Flint loans, what areas were redlined and what it looks like now in terms of their health and health outcomes. So it's
absolutely, Jennifer, and my students, because I teach social determinants of health for U of M Flint for their graduate course, and one of the activities that we do is we get the old school red line map. Yeah. And then we overlay health disparities by health indicator. So we look at heart disease, we look at diabetes. Yes. And we just overlay that map on top of the map, and they almost pretty much align perfectly still in 2023.
Absolutely. The maps are the data overlays, and it's really disheartening. One question for you, and I want to be respectful of our other guest time, is just if you're a community member and you're watching this and you're learning about social determinants of health and how important it is not just to go to your doctor, right, but to engage with other resources. Do you have any last advice for people who are like, okay, I understand it. What's my next step? Like, what should I be looking at? What should I be thinking of as a next step to be thoughtful about how I address social determinants of health in my sphere?
Well, I think the first thing in your sphere is look at your sphere of influence. Okay. One, we need to have conversations about this. We need to educate our family, our friends about the social determinants of health, because you would be surprised how many people this is like totally foreign to them, this understanding or this knowledge. And so not only can you become a help messenger, if you will, within your sphere of influence, but then you can also start convening around social issues. For example, in Flint, right now, we have a big issue with the Ajax Asphalt Company that's building right across from one of the housing projects. That's a social determinants of health issue, right? The water crisis, a social determinants of health issue. And so I think after you educate and create these conversations, start getting involved in local issues that you see. And once you take a deeper dive and really look at them through that social determinants of health lens, you will see the direct connection between these social issues and the overall health, not only of you as a resident, but your family, your friends, and your loved ones.
Dr. Keith, thank you so much for your time. Look forward to seeing you on another webinar and in our hallways, because we're office mates, so or we're building mates. So
absolutely. Thank you all for having me. Have a wonderful day now.
You too. Next, we're going to talk with Kristen Centers Young. And Kristen, I think I missed like shouting you out at the beginning of the webinar, so I'm so sorry. Blame it to my mind and not my heart, please. But thank you so much.
Everybody gets so excited seeing Dr. Key that we get distracted.
Exactly, right? Whenever we get to see our friends, but you're one of my friends. So thank you so much for coming to talk to us about your underage drinking campaign. Thank you so much for giving us all of your trusted information, and I'm going to let you have the floor.
Well, I wish this was my campaign, and this is actually a national campaign that's out from the Substance Abuse Mental Health Service Association. So this is the federal government. And one of the reasons I wanted to bring that up is I know that as we're going into spring break, a lot of us are starting to think about like, oh, it's spring break. I need to make sure I get messaging to my children about drinking. And it may be a little bit late. And so we do have prom and graduation coming up, and we do have, of course, concerns for our children. And SAMHSA has developed a campaign that's been going for quite a while now called Talk They Hear You. Really looking at the idea that when you talk about those spheres of influence, you know, we know in prevention that parents and family really do have a huge amount of influence on their children's substance use and misuse and a lot of the behaviors that lead up to that. And so this is a way to prepare parents and other people in children's lives and how to have some really difficult conversations and how to address some of their concerns. And also to look at their own behavior and how their behavior is influencing children around them. And so, again, the Talk They Hear You, it's really easy to access it through samhsa.gov. And there's resources for providers, and then there's resources for parents, and being able to make sure that those conversations are happening. They also have the Screen for Success available. And that's just a couple of questions to be able to really sort of look to see what kind of conversations that you should be having, or if there's you know, maybe taking your child in to talk to the doctor to be able to get some more information and do some further deep dives. And one thing I like about this is it's two ways to kind of get the access. One is to download a mobile app. But if you're like me, I have enough apps on my phone. The last thing I want is another mobile app to dig around through to try to find what I want. And so you can go to the direct link and get that straight through the website. Fact sheets, brochures, there's a family agreement form that says sort of like, I agree to this and you agree to that, and have a contract with your children about substance use behaviors or any other behavior that you want to adapt that for. The Screen for Success. One of them is a toolkit for a parents' night out to get together with other parents that you know from the neighborhood, from your church, from other organizations, and just get together as parents and talk about like, what are we all going to agree on as our children visit each other, spend time together, or we have some consistent messaging, or just want somebody to hear us out as we're talking about feeling overwhelmed with some of the things that's happening with and the messaging that children are getting. And then ways to have discussions with our own children, with the young people in our lives. I'm an aunt, and so many of my nieces and nephews are heading up into this age. And so how do I move from being that cool aunt to that one that's saying, you know, this isn't cool, and being able to have those conversations with people that mean, you know, a lot to me. And there's examples of that. Back in the 80s, we used to have this public service announcements that were sort of like, this is your brain on drugs, any questions? But nobody gave us the answers to give to the questions they had. And so now we have this campaign that really does say, now when they have the questions, here's the set of answers and the discussion starter kit to back that up. So highly recommended, especially for those that are starting to get concerned about what's happening at spring break, prom, graduation nights, as your children leave home and go to college. And what is strong messaging that you want to have around that? And I'm not in control of the slideshow, somebody else is. So, oh, there we go. Youth and alcohol. One of the things that's tricky is that, yes, a lot of the things that are aligned with symptoms or warning signs of drugs and alcohol can be aligned with many other things. Dr. Key mentioned ACEs, adverse childhood experiences, but some of it's just being a teenager. And some of that could be very much what we talk about, age expected inappropriate behavior. And some things we just sort of expect once children are getting of certain ages, they try things, their parents catch them, and we should have a prepared set of tools for how we respond to what we expect them to try at that age. I always relate this to, you know, that first time that your teenage daughter does the eye roll, ponytail, flip, stomp, pivot, pirouette. Like, you should be prepared for that. They might be joyous when they're 2 and 3, but when they're 13, some of that behavior is going to come up, and have some preparation for how you're going to respond to that, or whether or not you're going to respond to it at all. Mood changes, flare-ups, irritability, defensiveness. This could be ways in which they're dealing with bullying. This could be ways in which they're dealing with a breakup. We don't really know until we get into some discussions and being able to, as adults in their lives, really listen and find out how are some of these guys going through. The same with school problems, poor attendance, grades. I do have one highlighted, and that is one of the things is, as a therapist, I look for, and that is big changes in friends. People that they used to hang around with that now they have some pretty negative commentary about, you know, maybe they're not cool anymore, or they don't know anything anymore. And so they're dropping people or kids that they hung out with for long periods of time and adapting others. Or there's people that they really want to hang out with that won't have anything to do with them anymore. And those are some of the things as parents we can sort of see as are the names that are being discussed changing. And looking at why is that in some of the things that are going on could also be related to bullying, unfortunately. But we can also look at the idea that a lot of kids who are moving from into use and misuse and addiction, a lot of their peer group will drop them off, basically, be out of some concerns. And that's one of the things that you can kind of keep an ear out for an adult in their lives, and who's the names they're talking about and how is that changing. And just not wanting to do anything, changing interests. And the other one thing I want to think is, I should have highlighted it and it was red, is that changes in sort of like hygiene. You know, a child that all of a sudden is buying tons of mouthwash, or you know, your teenage boy that's got a collection of air freshener gets suspicious as to why they all of a sudden want to have incense in their room or air freshener in their room. It's not really, I guess you could say, one of those things that you see a lot of 12, 13, 14-year-olds starting to want to pack up on Febreze. And so what are they covering up with these kind of purchases, or they magically come up with something that's different from what you keep in the home, and you know they had to have spent their hard-earned money on a can of Febreze. Be very suspicious. Also, you know, when we talk about memory lapses, poor concentration, the bloodshot eyes, a lack of coordination, slurred speech, this is when they're already drunk or under the influence. But you can usually, by keeping an ear out, see some of those changes before they come up. I saw something in the chat. Should I be checking chat?
I will have the chat for you, no worries.
Oh, good, thank you.
We'll circle back around to the chat when you're done.
Okay, thank you, I appreciate that.
No worries.
And tying back in, I'm so glad that I got to follow Dr. Key, because he was talking about social determinants of health, and they really play into one of the things I also wanted to address is that, you know, the field of prevention and it has changed so drastically from when I was in high school. Back when I was in high school, they would do things like put burned out cars in front of the school and flip it over and try to scare youth away from drugs and alcohol, and it really had some of the opposite effect. You know, telling kids who are attracted to high risk behaviors, not to engage in a high risk behavior is not helpful. And what I mean by that is, kids will, they're not shying away from things that parents would think is dangerous. And so scaring them away doesn't necessarily help. What does help is having those protective factors and those social determinants built around. And so a lot of those, again, are being able to recognize that they're in a community that cares about them, that they have volunteer opportunities, they have opportunities to contribute to the community that cares about them. They have positive peers. They're around people that are doing things that are. One of the campaigns that also SAMHSA does is called Above the Influence. And so I just don't have time for that. Being able to talk about integrity and that idea, am I living the life that I say I want to live, and am I living up to some standards within myself? Again, creative activities, being able to use some of our social, our community partners for being able to have music and art and dance and all the expressive things that kids could be able to utilize. Reading for pleasure, of course, access to libraries, and then also being able to have that youth, I guess you could say, decision-making and involvement and leadership. And there's a lot of things that we'll teach when talking about that future orientation. We have media that is can make the world sound very scary and overwhelming and hopeless, and being able to really help youth sort of process through sort of what that looks like on the news versus what their future could be, and the fact that there really is a future for them, and that they get to have some input in what that is and helping to direct that, rather than having them have media influence them in a way that it seems sort of dreary. Again, I grew up in the emo age where we wore a lot of black and spent time in the dark, and it seemed pretty dismal. But there is being able to have that future orientation is an important piece too. And that's the end of the slideshow, I think. So yeah.
Go ahead.
So I just wanted to touch base and talk about as we're heading into, I want to say the typical misuse of alcohol period of the year, between spring break and prom nights and graduation parties. I unfortunately lost a friend graduation night on my own graduation night. Somebody that nobody would have expected, and somebody who had an athletic scholarship. A couple of bad decisions, and we lost her that night. And so for me, it's really important to be able to start having these conversations with our kids early and be able to set some standards and expectations, and allow some space to be able to talk.
Thank you so much for all of this really important information and for sharing your own personal experiences and stories. And I think this is really timely, particularly as you've alluded to like the timing rate for a lot of us. It's spring break for our kids and our loved ones. I appreciate also your focus on the idea that, I think we think of drinking as harming only that person, but it can be multi-generational trauma, right? And so I wondered a little bit about your thoughts on people who have kids who are sort of in the age where they might have peer pressure to drink, but themselves drink during the week, or the kids are seeing parents who maybe they're drinking socially or what have you. And as we know, in kids, modeling behavior feels like an important piece of how we teach kids what to do. And so how do we have that discussion? Like, oh, but mom, you have your glass of wine every night. Why isn't it okay for me to have a beer with my 17-year-old buddies, right? Like, what does that conversation look like?
Right, and I've got to practice this because I do clinical work in a substance use treatment disorder. So of course, the parents I work with really know that their past behavior is going to be thrown up at them when they try to have these conversations with their kids, and we practice it. I mean, that's one of the things to really be able to do is, like I said, there is some age expected inappropriate behavior. Your 15-year-old will bring up some past behavior of your own and throw it in your face. It's kind of like what they do. You almost want to like set a calendar alert for when some of the youth are going to do some of these things. And so practice it. I like the idea of that parents' night out, sit with your friends and talk about, when I do talk to my daughter about, her first date or her, drinking, or if, I used to have conversations with my grandma, and very young, I'm talking 14, never let somebody hand you an open drink. You always open it yourself. And people would say, like, you're telling her to drink. And she's like, no, I'm actually telling her to get home alive. This is really important to me, and helping me understand how important and how dangerous being under the influence is in public. And so those kind of conversations, I think, are very, very helpful, and don't shy away from doing them before you think you need to. And saying, starting to have conversations with kids that are in 4th and 5th grade about some of the challenges that will happen in junior high. Talking in junior high about what are some of the challenges that could happen in high school and going up into college, and practicing them. A lot of us have people in our lives that have children that are about the same age, and we can sit down and start role modeling and practicing these.
I appreciate so much the context of make this a part of your normal conversations, right? You might have a conversation, and you've articulated, people have conversations about first dates or first whatever, and why not normalize this as a part of, like, no, this is a conversation we have regularly as well. There's a question in the chat, and I think it's a really good one, especially as a physician. How can you gently introduce this resource to other parents in need without alienating and offending? And with my physician hat, I think, you're in the office with a 16-year-old and the parent. How do you introduce resources like this so you're not like, oh, you're doing a bad job, mom or dad or whoever? How can you make sure that parents understand this as a resource without alienating or offending them?
And I think you bring up an idea that, most parents are great parents. They're great with what they've got. But the problem with children is that as soon as you get raising a toddler down, they become a preschool.
They change.
You know what I mean? They change up on you so quickly. And so just being able to say, now that your child's entering into sort of this new area, and you're building into the parent of a different person, basically, because they keep growing up. And so being able to just recognize that there's this developmental changes that happen, and that so parenting skills is always something that you have to stay up on. It's sort of like as a doctor, the community, the continuing education units that you need to get. And so it's always a growth process. And just being able to look at the idea that we're talking about developmental assets, and then we're talking about developmental milestones, and that this stuff changes up. And it changes up around them, and it changes up with who they're exposed to and who they're hanging out at school. And that's the easiest way to do that, is like, oh, congratulations, you can get them to eat something green and go to bed on time. That's great. Now we need to start talking about what's going to happen when they're moving into the next phase, and they know how to, like, sneak off with a computer and get online with somebody they shouldn't. And so these are the kind of things that you would be continuing to be able to introduce that stuff. It's just normal child development, as you would any other kind of child development.
I really appreciate, again, that contextualization, right? It's normal child development. So you're having this conversation with your kid. You're saying, you're about to go to high school, and, there might be several challenges, and I want to talk to you about what those challenges might look like. What are some strategies that you might give parents to give their children to say no to alcohol when the parents aren't present, right? So I know you're going with your buddies after school, and you might be at so-and-so's house. These are the 3 things you should, say if someone offers you a drink.
Well, one of them is, you can basically just say, I don't like the taste of that. I don't like it, how it feels. I have homework. I have to get up in the morning, just the usual things of, like, I know what this does, and it's not for me. Not all kids are comfortable in being able to set those kind of limits and boundaries when they're trying to impress peers, though.
Right.
So basically, one of the things that luckily, and it was true, I built it up a bit, but, the smell of marijuana makes me sick. And so I just used to tell people I'm allergic. I'm allergic to this, or I'm allergic to that. And then having them prep up and being like, say, I can't have that. The same way they would say, I can't have peanut butter. And just being very comfortable in being able to say that. And like I said, half of it was true. The smell of marijuana still makes me sort of nauseated. The other thing too is set up codes with parents and say, what the best way to get out of any kind of event is to say you have some kind of gastrointestinal problem, and everybody will let you go. And so, you know, how do I get out of doing that? And being able to let them know that if they want to call their parents and say, my stomach's upset, I need to go home, that the parent then knows, you know, okay, maybe their stomach is upset, but this is that cue that, you know, the child felt very overwhelmed, or just say, my stomach's upset, I don't know if it's a good idea to drink that. And people will back off from that without having to explain too much. And again, practicing. You know, practicing, say it a couple of times, and so that you get used to the idea of how you use those terms. It would be wonderful if everybody just had the, you know, the confidence in themselves to say, you know, like, I don't have time for that. But not all children do, you know?
Well, I mean, and developmentally, right, these are children who are learning that skill, right? Literally, you know, the kids who are, that's part of the reason for the prevalence, right? Is we have people who just haven't evolved and developed to the stage where they understand how to set boundaries, right? Which is a level of emotional maturity that many of us haven't quite developed yet.
Right.
So certainly we can't expect necessarily that our teenagers are going to necessarily be equipped with, and I appreciate your recommendation that we have to equip them with them.
Right. And I think that, you know, there, again, I grew up a long time ago, but, you know, just the ability to be able to say the campaign, just say no. It's like, that's easy unless you've been raised that, you know, it's very difficult for you to say no to anything, least of all saying no to your peers when you're trying to fit in and feel cool. And how do you say that where you're still being able to keep friends at the end of the night?
You're absolutely. I think that's one of the biggest sort of goals of people of this age group, right? Is I still gotta keep my friends, and so they're negotiating what that looks like for them. Any last comments that you want to leave people with? Any thoughts about partnering with schools for this sort of dissemination of resources? Any last thoughts you have?
Well, one of the things I do is I sort of want to request that everybody go to the SAMHSA website. There's a huge amount of resources, not just about this, but also about youth development, mental health issues, substance use, and a variety of things other than alcohol. It's free. It can be a little bit overwhelming.
Oh no. Looks like we lost Kristen. Can you all hear me okay?
We can.
Yes, we can.
No worries at all. That was like the cue for me from that I needed to bring Nicole on, and that I wasn't being fair to her in terms of time. So Nicole, I'm so sorry, and I want to make sure you get your opportunity to talk. And Kristen, I see you're back, and if you just put your last comments in the chat so people can see them, that would be amazing. Thank you so much for all of your resources. Nicole, I am so happy to have you back after the last time that you were here and you talked about all of those really thoughtful things to think about with kids and how to keep them safe. Everyone was just like, we want to hear more. What should we do? Like, I think the ramen noodle thing just like blew people's minds. And so we wanted you back.
There is, I assure you, so much more. So I'm going to take like a small dose, okay?
No worries.
I know every time I do any kind of a presentation, it's really important to say, if you go to the next slide, like obviously using best practice, representing the hospital, the trauma center, our American College of Surgeons, but planning what is the topic, the group that we're talking about, and then whom will I be talking to? Like who's the audience? So whether you're a physician or a doctor of anything else, and let's say you're the person that keeps kiddos safe because you're a parent, or you're speaking to kiddos and peer groups, there's always just like such a variety of messaging. So I'm going to go like a little macro and a little micro on the message, and you can go to the next slide. In the month of April, I tend to focus things around the timeline, because right now we're going into Child Abuse Prevention Month. And truth is, I have a big grant from Safe Kids, and it's about drugs and medications and the safety of like poison prevention. And edibles are huge right now. So we don't talk about those enough. And I know that with the legalization of marijuana, there are benefits as well to our communities, but then there are a lot more safety risks. So in the spirit of risk reduction, understanding edibles, hiding and putting things up, storing medications and poisons separately, And these do fall under with our child abuse prevention this month initiatives. Again, that public health slant, the $585 billion in costs around the not preventing child abuse. And then, as we talked about in April and always, is fire prevention and burn prevention. So those ramen noodles, they do a lot of damage, and it's a horrific, life-changing type of injury. But this home safety and your habits around these things, and then hiding matches and lighters, which also goes back to that marijuana legalization and smoking around kiddos. The next slide is going to allow me to just kind of talk about segments of age groups developmentally, because we look at the home and we look at the vehicle safety around the roads, and then how they're playing, what kind of injuries we see. The smallest ages are toddlers and our school age kiddos. The languages they speak to get those messages to them to make safe choices, or to their caregivers to keep their kids safe. But extra attention with the little kids. I know I said before, when you asked about the biggest tip, and it's just that paying attention, that looking at the kids and not the phones, especially with drowning. We're coming up on swimming and outdoor activities. Kids get into everything, put everything in their mouth. We all know that. And falls are our number one reason for injuries that come in the hospital. But an important point is that top heavy kids, they fall out of grocery carts and windows, and these awful falls that we don't think of, but always taking that extra step and buckling kids in, belting them, keeping their temperatures stable. Toddlers, they're just clumsy and they fall. But I always tell people to the names and addresses. Do you know if your child who can speak gets lost and we ask, what's your mom's name? They say mom or they say grandma. So understanding, of course, that they need to know a phone number, an address, or a real full name. So we have all of these special needs considerations and special kids considerations. And those are just bullet points. If you go to the next slide, school age kids, we look at that as the highest risk, because at Hurley, when I look at the age segments, the 0 to 3 and the 4 to 7, I didn't even put that on here because falls is always number one. But we look at the jump from age 12 to 15 and then from age 16 to 18, where violence just jumps to the top of the list. Motor vehicle crash injuries, usually at that age group, they're either driving or as they climb in the 12 to 15th age group, the motor vehicle crashes is because they're not using booster seats. But you see those violence-based injuries just climbing the age brackets, and then again, the cost of those injuries. So using that data, if you go to the next slide, please. That very vulnerable age group, as she was just talking about, with substance usage, 16 to 18 years old, they have so many more risk reduction opportunities. The violence, the online dangers, 7 out of 10 teens getting messages from strangers. And if they're not into their peer group, truth is they're going to make friends where, you have to watch their phones, who they're speaking with, and those friend groups that they don't even know, chatting with strangers who could be of danger. So the next slide, please. Another thing about those teenagers, that angst around that age group, okay to say, is a really great tool. It's violence focused, but it can also be a support system for caregivers in schools, and silencing, or they say stop the silence and then help to end the violence, but opening up confidential, reaching out for help opportunities and channels into networks that can help kids. They're all teenagers. They're going through all the challenges. Teen dating violence is up. Again, opportunities for violence. There are so many things that we can just try to plan for. And then these tools, they're available. On the last slide, I'll give you some places you can plug into. The next slide, we'll just go into car seats, because I could spend all my time doing car seats. So let's go back to the little tiny kiddos. Learning portals, videos. There are so many opportunities to learn about placements and use links online. But I could talk about car seats for literally 2 hours just alone, and then train and do classes outside of the hospital to prevent injury and inside of the hospital to help our families. But think about having a class. You can go to the next slide. All the child passenger safety and car seat stuff, it is available at safekids.org and through Hurley. So if I had to choose the 10 most common messages, because motor vehicle crashes, they rank in the top 3 always through all ages. First of all, it's just having a car seat and using it. I saw last summer a kiddo in a back seat with their head out the window, and they couldn't have been more than 5 years old. And I tried to chase down the family and just tell them about a grant program. And a lot of parents, they just don't even want to use a seat. So we have to meet people where they're at with the message. Do they have a seat? Do they want to use it? But make sure they're locked into place and be sure that they stay rear facing because it's safer. We can talk about just the network of car seat technicians. And again, I could do a whole thing if you want to go to the next slide, just on being sure that you reach out and plug in to get information. Safe Kids Michigan, under the Injury and Violence Prevention segment of MDHHS, they have everything about car seats. It's actually the ultimate guide for car seats. That's what it's called. So, but you have injury and violence prevention resources at the state that they'll give you free things to hang in your office or in your social services agency. And they'll provide you with tools that are no cost. And the next slide, specifically for those weird age groups in transition, the 4th grade to high school, school age videos are very impactful. So Okay to Say has, you can click right on and play videos if you've got an audience of kids about bullying, about safe choices, risk reduction, and they're available to anyone, and they're all at the state, just like Safe Kids and the Injury Violence Prevention segment at the state or section is available with free tools. And then the next slide is how to get these in your hands, either through us, through the Michigan.gov, through Safe Kids. They all have items that you can print, all ages, all risk factors, and hopefully for your physical safety, we can keep you out of our hospital. Not that we don't want, the business at Hurley if we need it, but ask a nurse, any nurse that's cared for a child that's been injured, and we will do anything we can to try to help prevent those injuries so that no one has to suffer. And I appreciate your time. Just blaze through that.
No, that was phenomenal. I got to tell you, as a parent of 2 kids, car seats are the bane of my existence, not in like a I don't use them way. They're in a like, it takes a lot of effort to get them appropriately in, right? Like you have to.
They
be
do
really
not make that
thoughtful.
easy at all.
It's not.
It's like they
easy.
made it hard.
It is like I have changed travel arrangements based on having to move car seats into another car. I want to ask you, what is the most important thing? And you touched on a few of them. One, use a car seat, right? 2, making sure the harness is at shoulder level. Are there other things, tips and tricks we've got like a minute left that you frequently see as like people get this wrong and I want to make sure they get it right?
We look at the most damaging injury that maybe opens the most consults medically, and that's a big driving force. If there's a crash, your biggest injuries are going to come from the chest clip not being up high enough at the armpit level.
Okay.
Your biggest injury for the kiddos and boosters is not using a booster, because when the seatbelt at the force in a crash presses on the soft belly, and this goes for all people in a car, if your seatbelt is not on your hip bones, like a booster seat provides for a kid, that seatbelt literally can transect the body and go all the way. The next hard place, as terrible as it is the spine. Using boosters, having the chest clips, having rear facing. How many people tell me, oh, but the feet, my kids' legs are long and they're not comfortable.
Yeah.
Yeah, I'd rather see a broken leg any day than see a spinal resection or any problem with the spine forever. But again, just using them, learning how to use things properly, only using one attachment, the seatbelt or the lower anchors, using the top tether if you have one. using a car seat, knowing that it's a priority and taking a moment to use it properly each and every time.
Last question, where locally can people get their car seats checked?
If you go to safekids.org or Safe Kids Michigan, you can search all of the techs within Genesee County and the region. We all know each other in most of the state. There are, with the 8 trauma centers, there are 8 Safe Kids, or actually 11, I think, Safe Kids groups, not all through hospitals. And all the car seat techs know each other. We have, you can put in a request at Hurley, but we have through maybe 9 or 10 agencies, fixed stations every month, police and fire and social services agencies. So they're all around Flint. We can get grants. Please, though, consider getting certified if you're passionate about car seats, because we need more instructors. The more instructors there are, the more people we can help.
Thank you so much, Nicole. We really appreciate your time and your expertise.
Thank you.
All right. Thank you to all of our partners, and thank you for your time and attention today. We're excited to see you next week, and a reminder about continuing education credits for our community health workers. We'll see you next week.